Wow, that was really illuminating about the different types of heart disease and really the extent of it in our community. We might not even realize it, but it's just such a big thing that we're living with as a community. So then how will we know if we're at risk of developing heart disease? Because statistically, I think the Heart Foundation has published data that about 1 in 6 Australians are at risk of developing heart disease or are living with heart disease for that matter. So I've read a little bit about this, Jodianne, in my time as a founder for Cormagna. There are risks that we can't control and risks that we can control. But maybe tell us a little bit more about risk factors in general. What does it mean?
Yeah, so obviously these are things that might lead you to have heart disease at some point in your life, and you mentioned ones that perhaps are out of our control. So the sex that we are born.
So whether we're male or female?
Yeah, so males generally have a higher risk of certain types of heart disease than women. Once women get to postmenopause, then their risk is said to equate to a man's risk for the same age.
Right.
But up until then, men will have a potential to develop it at a slightly earlier age.
Right.
And then your genetics, so what you inherited from your family. And people will often have a history in their family of someone dying of heart causes or someone having heart problems.
Yes.
Sometimes they know what it is, sometimes they don't. But what you inherit genetically might be a risk for certain heart diseases. And obviously we don't have much control, at least at this age, of what we got from our parents or grandparents even.
Yes.
So there are a couple of the risk factors that we can't control. The other one is our ageing. So at least to this point, we don't have any magical answers for ageing.
So all of the anti-aging things, miracle pills that we hear about, probably don't put too much stock in those.
Well, I think there are lots of things that we can do that will reduce the potential for ageing, but obviously this is a watch this space type thing. There is no magic pill.
Yeah.
So as it stands, we age with time and we can't control that. And as we age, the risk for heart disease increases. And it's not just one type of heart disease, it's several types of heart disease.
And the different risk factors play into the different types of heart diseases.
Correct.
So these are things, risk factors, which just come with us from being us, who we are.
Yeah.
These are things we can't control. And then risk factors that we can control, there's lots I've sort of come across about that. What are those types of risk factors?
Yeah, good question. So there's ones that often people have heard of, like smoking.
Yes.
Smoking, of course, is an addiction. And so whilst we say we can control it, I'm not going to say it's easy for people necessarily to abstain from smoking if that's a habit for them.
Yes.
But, what is important is if you can stop, or better yet, don't start, then you're going to significantly reduce your risk of certain types of heart disease. People don't often think of alcohol as a risk, but alcohol is a risk for heart disease.
Yes.
So again, sensible habits when it comes to alcohol consumption, doing it in moderation and perhaps not every day is an important step that people can take to reduce their risk of certain types of heart disease. Then there are other things like blood pressure as a risk. Now,
that's interesting.
Yeah, now this is an interesting one
because
it's
usually lumped in the risks that you can't control, but this is something that you can control.
So high blood pressure is complicated because it probably does run in families, so there probably is a bit of a genetic predisposition to getting high blood pressure, but there are also other factors that might drive high blood pressure and that are in our control to amend. So that also goes with the development of diabetes, which is a risk factor, and to some extent high cholesterol.
Right.
So for some people that's strongly in their families and less in their control, but dietary inputs are still a factor that influence the level of cholesterol or diabetes and the outcomes
sugar,
associated with them.
Yeah. And it's really interesting, isn't it? I think we often think that, because, my members of my family have diabetes or high blood pressure, and so then it's only natural that I should expect to develop these diseases at some point in my life, which then all, they all correlate, and they're known as comorbidities, and, it contributes to developing heart disease. But I think sometimes if we reflect and think about the practices that we learn as a family, if we see our parents or our family members or our elder siblings eating the way they do, and we learn these habits of, this is just what I've had for breakfast all my life as a child, and you continue with these habits. So this is what I've always had for dinner. We have red meat 4 times a week, for instance, or, things like that. And we eat a lot of fatty foods, and we have butter and all that kind of thing. And we have lots of sweets. We have desserts. I think, sometimes we might want to question it a little bit. Is it genetic in the sense that biologically that's just what comes with us as a human package? Or is it something really that is a result of adopted practices over the years? And then it becomes associated with family because that's what we do as a family.
And this is where it gets interesting if we talk about racial origins, for example, as a risk factor, because some of those risks come from with diet, the genetics, but some of them come with the lifestyle.
Right.
And it is hard to tease those aspects out unless you start looking at, say, for example, Japanese family that grew up in Japan with a very traditional Japanese lifestyle, but then maybe the grandchildren move away to a Western culture. And there are studies that look at these things and look at the impact of the Western lifestyle on that race of people. And there are definite negative impacts in that scenario.
Right. You see, so, that's really important to think about it in a, slightly more nuanced way as well. Now, I think I want to circle back a little bit to the risk factors that we can't control. So in my family, for instance, I think we all know this by now, we've got a history of multiple types of chronic diseases, heart disease being one of them. Does it mean that I should just sit back and wait for the inevitable and, I only live once and I'll just, do whatever. I'm going to get it anyway. I'm probably going to get a heart attack or a heart failure.
No, because you might not. And so first of all, even if you inherit the genes, there are now, we talk about epigenetic factors that stimulate those genes, trigger them, turn them on, turn them off.
Right.
And so lifestyle things might impact the risk that genetics is then expressed. So you should first of all definitely not just assume that because it runs in your family, you're definitely going to get it. You could take that as a note to self-warning and say, all right, well, I know this is a risk for me potentially, and then you might want to actually be proactive about how you look at that type of risk and say, all right, maybe I cannot prevent this particular thing, but I can get educated about it. I can have my heart health assessed by a professional, and then I can see what things I could do that might prevent me ending up in the same boat as my grandparents, for example. And I have lots of patients who come to me with this exact story.
Yes.
In fact, just recently
I have
the son of one of my very fit patients who ended up with very bad heart disease.
Right.
And his son is only 30, but he wants to make sure that he's right on top of everything that he can control to prevent him hopefully going down that same path.
Oh, well, that's very good news for me. So I'm very comforted by the fact that there are things that I can do. And, we've had so many discussions about, dietary choices and lifestyle choices, Jodie. And so that's definitely good news for the people out there. And I think what's important to really understand risk factors is they are risk factors. And so that itself tells us that there are steps that we should be able to take to prevent the materialization of these risks.
Yes.
So just because you might have certain predispositions, we can take steps. They are still just risk factors.
Yeah.
There are steps that we can take to keep the materialization of these risks at bay if we are on top of things and if we are proactive about our health.
And just one little piece of extra motivation to go out there and do this. Whatever affects your heart and the vasculature of your heart will also affect your brain. So if having a stroke or having dementia scares you more than having a heart attack or some other heart problem, then use that as your motivation to have good heart health.
Absolutely. Yeah, absolutely. I mean, we all know that, when one thing starts going, it's just a matter of time when the rest of the body starts to, overcompensate and things, start to fall apart. So definitely want to make sure that we do our best to keep our heart health in check. And to, even if you think you've got certain risk factors that you cannot control, they are still just risk factors that you can take steps to prevent them from expressing, as you mentioned, or materializing.
Yeah.
So there's always something that we can do. Let's go and get it done.
Excellent.
Thanks, Jodie Ann.
Thanks, Amber.